Hi everyone. So I'm going to come on here and talk to you about how I'm feeling. I had my retrieval this morning at 11 o'clock this morning. I was home by 1:30 maybe. So I just wanted to go over how I'm feeling right now first before I do anything. So I actually did really well. Better than I expected at the clinic itself. I felt fine. I was very awake, very oriented. I didn't have any drugginess like I thought I was going to have. I think my main focus was I wanted to know how many eggs they took. I was very disappointed to find out there was only 8 eggs they got out of my 13 to 14 follicles. So that was very discouraging. I'm not really hopeful this cycle, but I'm trying to be optimistic and at least hope for 1 embryo for my transfer. So we will see. So anyway, so I was fine. I had my McDonald's fries. I got home. I have not slept. I did not nap. I haven't slept. So, I mean, overall, the anesthesia did pretty well because I am not groggy. I'm not dizzy. I'm not tired. I mean, like my body is tired. So I am kind of tired. But, I mean, I'm not overwhelming. Like I had to go to sleep. Like I said, I have not napped. However, it's almost 7:30. And I'm pretty sure the anesthesia is almost worn off. So I just want to see if you guys can see. I'm sorry, I'm not wearing a bra, you guys, but I just had surgery, so. But I don't know if you could see. My belly is very extended. It is very, very, very extended. My belly is very hard to touch. It's very sore. It's not crampy. Like I'm not cramped. Like I don't even know how to explain it. A lot of pressure. I'm having a lot of back pain. So maybe the cramping is just turning into back pain. But I was heating it as suggested. But I actually decided to ice as well because the heat I just felt like wasn't doing much. It was helping, but only to a certain effect. When I put ice on it, the relief is so good. So I ice it until the cold goes away, and then I put it back in the freezer, and then I'll let it freeze for a little while, and then I'll, put some heat either on my tummy or on my back, and I'm trying to just stay in bed. Me and Johanna just watched a movie. So, other thing that I was very interested to know. So my band right here, it actually has my name, my date of birth, my husband's name, and his date of birth. And when they would bring me from room to room and all of that stuff, I had to recite my name, my date of birth, my husband's name, and his date of birth. So even though he wasn't there with me or having the procedure, his sample was traveling, I guess, with me into each room to make sure that we were to one. So I had to give both every time I did something. So I don't know if that's just my clinic or if it's by clinic, but that was with my clinic. So my bracelet does have both me and my husband's information on it, as if we were both the patients and not just me. So the other thing they gave me is a egg retrieval post-procedure instructions. Again, it has me and my husband's name on it, and our patient ID numbers as well. So absolutely no. So this is a list that we absolutely cannot do after retrieval. So no driving, no alcohol, no over-the-counter medication except for Tylenol. No operating machinery, no tampons for 2 weeks, and no sex for 2 weeks. And it says what to do when you get home, have something to eat, go slowly, nothing too spicy or greasy. So let me go on to that real quick, the food. So I had fries. I ate them. It's almost an hour drive. So I ate them on the way home. I didn't even finish them. I finished them when I got home and they were cold and gross. But I wanted to make sure I got those fries in. And then I had Josh run out to Taco Bell and grab me tacos. I'm not ready for you. I'll let you know. And I only ate one taco and I gave him the rest because my stomach just was not feeling right. Like I feel like I was gonna throw up and I didn't like that feeling. So I think I might have ate too much or too fast. So just when they say that, you guys, it's so true. Like go slow. Don't scarf. I know you're hungry because for me personally, my clinic had me on a liquid diet, a clear liquid diet all day yesterday and on laxatives. And then I could not eat or drink anything until after surgery, which my surgery was at 11 a.m. So just keep in mind. And then it says go to sleep. You will need to rest for the remainder of the day. I did not go to sleep. I did not feel the need to sleep. I was not tired. So, I mean, I guess it's different for everybody. I did lay in bed all day, and I am going to go back to laying in bed after I do this video. Drink plenty of fluids. I am trying my best to get as much electrolytes as possible. I don't know if I showed you guys the raw electrolytes that I have. The raw, like it's the not ROW, it's ROAW. No, ROAR, raw. And I know I'm probably pronouncing it because of my accent. You guys, you can make fun of me. It's fine. Those are all natural. Has no sugars, no artificial dyes or anything in it, and it's like Gatorade does, and it has electrolytes. So I've had 2 bottles of those so far. I should say I'm working on my second bottle. And it says what to do the next day. It says you may return to work. It says if you are feeling tired or sore, you may need to rest another day. I did take 2 days out of work. I don't plan on going back to work until Friday, but I'm going to play it by ear. As well. So, and it says you may shower. So I cannot shower today because they were worried that, I guess with the heat from the shower, it can make the anesthesia activate, I guess, and you can pass out in the shower. So they suggest no showers the day of the procedure. So I can take one tomorrow, which I plan on to because I don't feel good. Don't feel nice. A nice shower would do me good. Maybe the hot water too. So it says how to deal with the cramping. Like I said, I have cramping, but it's mild cramping. It's more right now. It's more like pressure, and I'm very gassy too. Like I don't know if that's due to the laxative, but I have gas coming out both ends, you guys. I'm not gonna even lie. And sometimes it does hurt to come out that end. So just let that be said. Then it goes into things to be worried about as far as abnormal things that you can experience. And this is primarily for infection. They did give me IVF antibiotics when I was there. And they said, you know, I wasn't exposed too much. It was only like a 15-minute procedure. But feeling dizzy for more than 24 hours, severe abdominal pain, heavy vaginal bleeding. When they say that, it says soaking more than a pad an hour or passing clots larger than a quarter. So I am bleeding, but not heavy. It's more than I expected, but not heavy. Let's just say that. It's very, very light. If I have a fever greater than 101, shortness of breath or chest pain, leg swelling or pain, and it gives you the number to call the clinic right away. So then they tell you the medications you need to be on right here. So starting tonight, that's why I'm making this video, starting tonight, and every night until the doctor tells me to stop, I have to take my progesterone oil, which is the injection, 5 milligrams or 1 liter, intramuscular in the buttocks. And they have a diagram, which I'll show you in a minute. Then starting tomorrow, I have to take the estrace, ESTRACE, 2 milligrams by mouth 2 times a day starting tomorrow, as well as the progesterone. And then not on set until Saturday, which is the 20th, will I start doing the intrauterine progesterone vaginally 2 times a day. And it says do not take it the day of transfer. So let me show you. So they gave me a diagram right here to where to insert the injection, which Josh will be doing it because obviously I'm not going to reach back there, or even try to right now, anyways. So this is what they said when I left. So I have 8 eggs. We're doing ICSI. ICSI is when they literally take one of Josh's sperms and put it directly in the middle of my egg individually and let it do its thing, fertilize that way, instead of just putting both his sample and my eggs in a dish and letting them fight to get to the egg. So we are doing ICSI. And so I don't know how many of my eggs were mature. So that's what I'm worried about right now, is if there was any mature enough to fertilize. I would hope that if there wasn't any mature enough, they would have called me already, but I don't know. So tomorrow, I will get a call some point tomorrow. They will tell me how many mature, how many fertilized, and then they will also schedule my fresh transfer. So that is why we're starting the progesterone today, because I'm assuming my transfer would either be Monday or Tuesday. But, all right. So without further ado, look how big my stomach is. It's so bloated. Holy freaking crap. All right. So let's get these needles. We'll use those needles that I already had opened up the other day. And I'm going to do another printout of another one of these, because this really did help of marking it down. So just for tonight, I'm just going to write progesterone oil. We're probably going to do this side, which is the right side. Oh, excuse me, you guys. Told you I was gassy. All right. So this is the progesterone oil. All right. So they say to do it on a clean, let me bring you guys down. On a clean surface. So I have a paper towel down in the sink. Okay. This is the progesterone oil right here. Okay. I do believe I have enough to last until my pregnancy test, my beta test, before I have to refill. So let's hope I have to refill, you guys. All right. So I still don't understand what that needle was for. That's fine. All right. So then we need to get this. All right, so ooh. All right, so this one, they said the one that's already on the syringe, the one that's already on the syringe is the one that you draw from, and then I change it to this one that I actually take the shot with. So, anyways, here we go. So it says to draw to 1 milliliters, because this is a 3 milliliter. It's milliliters, not milligrams. So that's probably why they put both, so that way I knew depending on what needle they gave me. So I'm taking 1 milliliter. So see, so we put the air in it. It also said to have a Kleenex, but I actually have non-sterile woven sponges that I'll just use. Like I don't know what I'll need. So I'll just place 2 of them here. So I'm just gonna put that back in there. All right. So now I got to clean the vial. So just give it a little washy wash. Guys, I've never done this before, so you just gotta bear with me, okay? And then I insert the needle, push the air. I don't know if you guys can see what I'm doing, but push the air. Okay, and then tip it upside down. Now this is definitely thicker than anything else that I've ever taken. Look, I don't know if you really can tell how thick it is, but it is thick. All right. So it says, is it even going in? The hell? It's not coming up. What the hell did I do wrong? Let's take this out. Let's draw it down, back down to 1. What the hell is going on? All right, well, trial and error, you guys, right? So this syringe just for some reason, ooh, I just stabbed myself. It's not drawing it. I don't know what I did wrong, but let's try again. It could be the needle, but we have plenty of needles. And I can always order more if I need them. I freaking stabbed myself. Don't do that at home, kids. Don't do that at home. All right. Let's try this again. Take this off. It says draw air into it for 1 milliliter. And then put it in here. Take the air in. Tip it up. Maybe because it's just so thick, it's just taking a while. It's literally going really slow in, you guys. Like I'm pulling back, but it's taking so long. To actually get in there. What the hell is going on? I'm almost at 1. I don't know why this is giving me such a hard time. Alright, I think that's item 1. It's definitely a lot of friggin' air bubbles in this thing. Alright. So now it is at a 1 with no air bubbles. See if you guys can see it. Where the heck? You guys see that 1? Maybe not. It's literally right down here. Alright. So we'll put this on. And twist this off. Put it in this. And put the smaller needle on. Alright. So I was watching videos and some girl said the easiest way to do it is to warm up the oil, to stick it under your arm and do things. I'm just going to sit here and maybe ice my butt cheek. I don't know. Or maybe mark my butt. I don't know, because that's what they suggested to do. But, alright. Does this go back on? So I guess these lids don't go back on. Whatever. So I will get Josh in a couple minutes and we will get the shot going. Okay. Alright. So this is what it says. So you have to, it says my butt is going to go on my butt cheek. So you have to divide it in like fours, it says. So my butt, go like this, and then here, and it goes in the outer quadrant. So somewhere over here, I guess. I don't know, because I can't really see my butt.
That doesn't look like the outer quadrant, though. That's where it's distinguishing. It's right above the crack. On the
no, it's not. My crack is all the way over here.
Yeah, but it's at the crack
the
line.
Butt cheek. You take the butt cheek, you go down, and you put 4. They said the best way to do it is with a marker. Mark my butt. Go ahead. Just the butt cheek. Just this butt cheek. Divide it in half, straight down. And then evenly across. Now, where's the outer quadrant?
Right here.
No, that's the lower quadrant. Up here.
All right. And this would be...
Why you keep marking me body? So, they can only see so far. It says you have to, so it says, we'll have to clean it with the alcohol, let it dry. And then it says, identify the site, upper outer quadrant of the buttocks, wipe area with alcohol, swipe using circular motion, let the alcohol dry. Hold the syringe like a dart or a pencil. It says to taunt the skin with your thumb and index. So you know how you were grabbing it? You have to actually go out like that instead. Not grab it, but just go like that. Do you understand what I'm saying?
Like this.
Yeah. Like, gotta spread it. So like that.
Pull the skin away.
Okay. Then it says to inject the needle at a 90-degree angle, just like you did with my other injection. So straight on, an L shape with my butt. Okay. It says inject the 90-degree angle, use a quick dart-like motion. So quickly, the quicker you insert the needle, the less discomfort I will feel. It says release the skin, hold onto the syringe so that you will not move. Pull back the plunger to check for blood. So you don't inject the medication, you have to pull it back a little bit. If there's blood comes out, you have to take the needle out and redo it. Okay? If there's no blood, you can slowly insert it. The medicine. Then you have to, after you take it out, you get this right here, and you're going to massage the area for a couple minutes to get the medicine in there. Okay? And then I'll go put heat on it when I go lay down in bed. All right. Let's do this. Okay. All right. So I put it under my armpit as I explained it. All right, so you pull it out to see if there's any blood. Okay, which would come up over here, I guess. God, I'm so nervous. All right, so I'm gonna bend over. You gotta clean the area with alcohol.
You don't want to do that?
I can't see. You know where it's going. Just take the alcohol swab and wipe it. Why are you making it so difficult?
I'm trying to. Stop moving.
I'm not even moving. That's not too high. Okay, whatever.
You want it lower? Now I gotta get that marker off there.
Nope, just do whatever.
No, because...
If that's where you circled it.
That's where I circled it.
You need another alcohol swab now. It's sterile, Josh. The needle's going inside my body.
Alright, I was trying to get the... Because the alcohol was sitting there smudging that ink around.
There's the other alcohol swab. Hold on. Let me put this down a little bit so especially so I can see it later. Okay, go ahead.
See, that's what I'm saying.
Okay. You think you need another one?
No.
Okay. Okay.
I literally gotta stick that whole thing in there.
The whole thing. Yep.
I'm not.
I know I'm getting it.
Yeah, but it's still. Alright. So now I gotta stick it
No, what are you supposed to do?
on the skin and stick it
90
straight in.
degree angle, all the way, dart-like motion.
Alright. And then I can let off and pull.
No, what?
I'm letting off the skin and drawing it
Yeah,
back.
then you pull off the skin. Once it's in, pull off the skin. Hold this with this hand. Hold this with this hand, and then pull it. Draw a little bit. If you blood, then we have to take it out.
Why?
Because it means you're not in the right spot.
Ready?
Just do it. A dart-like motion.
I did.
Oh shit. Okay, pull a little bit back. Just a pleasure. Okay, good. Nothing.
Nothing.
Slowly go in. It's oil. Calm down. Calm down. And then you gotta count to 5 when it's all the way in to make sure all of it goes in.
1, 2, 3, 4, 5.
Okay, now pull out. And then grab that and put it and rub it for a couple minutes. It says just we gotta rub it like massaging it, not just rub it, massage it. Yes. There you go. It says for a good minute. Believe it or not, it really didn't hurt as bad as I thought it was going to. That actually hurts, believe it or not, but it's supposed to. See, that's been a minute or no? You have to do this every day, Josh. Is it good? Is it bleeding?
It's a little red spot.
It's red, but it's not bleeding?
It might be bleeding a little bit, coming slowly.
All right, let me see.
See, here, I'll even show you. Oh, now you can see.
Yeah. Okay. Thank you, babe. You have to get used to this because I can't do it to myself. Clearly, it's behind me.
Yeah, well, it's not.
But you did really good, baby. Thank you. I love you.
It doesn't ease my stomach.
Holy frig me. Don't forget that.
Not my game.
Alright, you guys. So that was my first progesterone oil shot. I'm going to cap that in a second. I'm just holding some pressure to my butt, my upper butt top, I guess. To put it in the sharps container. But hopefully I have to do that shot every day for 10 weeks. Because, or up until it's going to be actually longer than 10 weeks because you take it until you're 10 weeks pregnant. So I don't mind taking that shot every day for that to happen. So I know as the days goes on, it's going to get more sore, and some people say it's hurt to sit. So we might just have to mark my butt every day. So, but yeah, so that's that, you guys. Retrieval day is now completed. So the next video will be on how our eggs fertilized and what we had for embryos. So I'm hoping for the best, you guys. Just takes one. That's what I keep trying to remind myself. Just takes one. We only need one. More than one would be a blessing. So I'm trying to stay positive. So until next time, you guys.